got Gandalf. Put them as a patient, the wise one. They know their disease the best. She's laughing at me now. I haven't said anything wrong. We can officially move on now. Hello there, my name's Dr. Khalid, and today we're going to be looking at House, one of my favourite medical dramas. Let's just have a look and see if there is any medical accuracy and if it does count as medical revision. Don't think so. She's having problems speaking. This could be one of the signs of stroke. What is she saying? Call Ghostbusters. Call Ghostbusters, I think. She's having a seizure. Call the nurse. Call the nurse. I love the style of House. It's always like takes you into somebody's life and then boom, some medical thing happens.
Other side, no environmental factors
that you know of.
And she's not responding to radiation treatment.
None of which is even close.
Wait a minute. So they think she's got a brain cancer. You don't normally start people on radiation until you've diagnosed them with something. You can't just go and start a treatment like that on a hunch, which they seem to be doing on this one. So that's a bit odd already.
Shouldn't we be speaking to the patient before we start diagnosing?
Is she a doctor?
No, but
everybody lies.
This is classic how nobody's telling the truth, everybody's faking it or holding back something that is going to be vital to the case. From my experience, that's not been the case. Yes, sometimes people give too much information, and as your job as a doctor is to be the sieve, to be the filter, the person that just like takes all that information and then comes out on the other side to say, well, actually, that part was really important. What you mentioned, let's focus. So it's redirecting the conversation to the important part.
Dr. House doesn't like dealing with patients.
Isn't treating patients why we became doctors?
No, treating illnesses is why we became doctors. Treating patients is what makes most doctors miserable.
Interesting. I could go into a whole other video about this, disease versus patient. In medicine at the moment, and certainly over the last 10-15 years, it's been a big shift. It is a lot more about treating people, communication skills, and that old archaic forms of you got to treat the disease and this is how we beat the disease just isn't useful anymore. What I guess we've realized is the importance of involving the patient on that journey so that they could understand the disease as well. So it's kind of like a common enemy between you and the patient, and you're coming together. I don't know why I just did that. It's kind of like Lord of the Rings. You've got the hobbits, we'll put them as the doctors, and you've got Gandalf, we'll put them as a patient, the wise one. They know their disease the best. And you've got Aragorn, and that's your history taking. And then you've got, let's say, Boromir. That is your investigations. Boromir can sometimes lead you down paths that could be a little bit astray, but the important thing is your key point is you've got to follow Aragorn, your history taking. That's 80% of your information.
We inject gadolinium into a vein. It distributes itself throughout your brain and acts as a contrast material for the magnetic resonance imagery.
So contrast MRI, basically an MRI is a machine that you go into. It's a donut-shaped machine. It makes lots of noises, and the idea is that we get a good image of the brain or the part that you want to investigate. If you give a contrast, the blood vessels will take the contrast and it will light up like a Christmas tree, what they described it as. And that way, when you look at the images, if there is something like a tumor, it will have its own blood supply, so it will light up really well on a contrast MRI. Importantly, with the contrast MRI, radiologists want you to make sure that the patient's renal function, kidneys, make sure their kidneys are working normally, because the majority of that contrast needs to be filtered out through the kidneys. And anybody's going for a contrast MRI, they need to have blood work beforehand to make sure their kidneys are working adequately. As you can see, it's in a confined space, and sometimes people can feel claustrophobic, especially if they have claustrophobia. We can sometimes give them medication that can sedate them so that they're able to go on and have the scan that they need. She's laughing at me now. I haven't said anything wrong. We can officially move on now. That's normal MRI machine sounds. There's basically a man inside the machine, and he's got a hammer or a wrench, usually just banging it. That just helps get the machine up and running. It's technology from the 50s. We haven't really managed to get anything that's better than that. The guy that's in there with the wrench is still the best that we've got. He's also got a hamster in a wheel, 2 hamsters and 2 wheels on either side of the machine, and they're the ones that are powering the whole machine. True medical insider, telling you how it is.
probably fell asleep. She's exhausted.
She was claustrophobic 30 seconds ago. She's not sleeping. We gotta get her out of there.
Just be another minute.
She's having an allergic reaction to the gadolinium. She'll be dead in 2 minutes.
Well, how she worked that out is, again, incredible. Super rare to have an allergic reaction to the actual contrast dye. Yeah, that's a big jump to go on, especially if she hasn't even got the lady out of the machine yet. For all we know, that guy with a wrench could have been attacking her. Just want to clarify, there's no guy with a wrench in the machine. Just FYI.
So how'd you get the job? You stab a guy in a bar fight?
And again, I miss these lessons in medical school where you break into somebody's house and go through their kitchen and their fridge. Doesn't happen. It's a medical drama. They've got to fill it up with fun stuff. And not that breaking into somebody's house is fun.
Where there's ham, there's pork. Where there's pork, there's neurocystic cirrhosis.
Tapeworm? You think she's got a worm in her brain?
It fits. Could have been living there for years. Never occurred to me
Millions
because...
of people eat ham every day. It's quite a leap to think that she's got a tapeworm.
Okay.
I had to look this one up, and yes, it can be in certain types of pork, can cause some of these symptoms.
No treatment.
Maybe we can get a court order, override her wishes, claim she doesn't have the capacity to make this decision.
What Foreman over here is talking about is to override a patient's wishes. You can't really do that. In the UK, what we do is a capacity assessment, but that's usually when we think somebody doesn't have capacity. Number one, the patient has to be able to understand the information. Number two, they have to be able to retain it. So some people with dementia, their short-term memory may not be able to retain that for the long enough period to make the decision. Number three, they have to be able to weigh up the information, so the pros, the cons, the risks of, say, having treatment and the cons, and they have to be able to communicate all of that, and that's number four.
Have you ever seen a worm under an X-ray? A regular old, no contrast, 100-year-old technology X-ray. They light up like shotgun pellets.
So that's been Dr. House, episode 1, season 1. I love it. It's, for me in medical school, when I was watching Dr. House, it felt like revision, even though none of it really came up in the exam, but it kind of got me into that medical thought process. You know, you're trying to work out what the differential diagnoses were, what investigation would they go for, and then they would actually start doing the operations and things like that, and then you'd be like, what the hell's going on? But anyway, I have got my ass scoring system. The first one is medical knowledge. I give it 8 out of 10 for this one. I've had a little look at this condition that they've talked about, and WebMD does suggest some of the symptoms they've kind of presented as plausible, but it's super rare. So if you're there with like your ham sandwich right now, it's cool. In terms of life of a doctor, I would give it like 5 out of 10. You don't break into people's houses to sniff the floor. You don't give people radiation just because you're like, meh. I feel House doesn't really represent what life of a doctor is because it's a super specialized show. They are seeing the mystery cases. Entertainment, for me, House is right up there. In terms of the drama it brings, a 9 out of 10 on that one. The average ass score is 7.5 out of 10. It's just behind the Scrubs one that I gave. I think I gave Scrubs an 8, and I'm going to do Grey's Anatomy on the next one, so stay tuned. It's been super enjoyable to do this. If you enjoyed it, then you know the drill. Gives it a thumb up, and I'll leave you with a question. If you're a patient in a hospital, who would you rather be treated by? House or Patch Adams? Leave your comments down below, and I will see you in the comments. Peace.